Hello guys, welcome back to my YouTube channel. From this video I'm going to discuss about the 11th cranial nerve, spinal accessory nerve. The accessory nerve consists of two parts as spinal part and the cranial part. The cranial part originates from the nucleus ambiguous, and it is composed of branchial efferent fibers. It emerges from the ventral surface of the medulla oblongata, and it is through the posterolateral sulcus below the rootlets of vagus nerve. This is the vagus nerve, so this emerges below the rootlets of vagus nerve. Then this is the spinal part. So this spinal part of the accessory nerve arises from ventral horns of C1 to C5 segments of the spinal cord by separate rootlets midway between the attachments of cervical, ventral and dorsal rootlets. The rootlets join to form the nerve which ascends in the cervical vertebral canal and enters the cranium through the foramen magnum. So, here is the spinal part and here is the cranial part of the accessory nerve. In the posterior cranial fossa, the spinal accessory nerve joins the cranial accessory nerve to form the nerve trunk of the accessory nerve near the jugular foramen. Here is the jugular foramen, and here you can see the cranial roots and spinal roots unite together to form the nerve trunk at the level of jugular foramen. Then what happens is, after reaching the base of the cranium, the accessory nerve divides into spinal part and the cranial parts, and again the cranial part joins the vagus nerve and distributed through its branches to pharyngeal, palatal and laryngeal muscles. This nerve descends, it lies anterior to the tip of transverse process of the atlas, and from here it descends in posterior direction deep to the stylohyoid muscle and posterior belly of digastric muscle. Then it passes through the upper part of the carotid triangle and then enters the substance of sternocleidomastoid muscle. Here is the trapezius muscle and here is the sternocleidomastoid muscle. So these two are the muscles which is supplied by this accessory nerve. So you can see the branches are given to this sternocleidomastoid muscle and the trapezius muscle. Then the nerve enters the posterior triangle around the midpoint of the posterior margin of the sternocleidomastoid. At this point, lesser occipital nerve hooks around the accessory nerve to turn in the upper direction, and the accessory nerve is surrounded by superficial cervical lymph nodes in this area. Then what happens is the spinal accessory nerve descends in posterior triangle from medial to lateral side between facial floor and facial roof, but line adherent to the roof. Then it enters the trapezius about 5 centimeters above the clavicle and travels towards the back line plastered to the deep surface of the trapezius and along with the superficial branch of the transverse cervical artery. Then it gives these branches to the trapezius muscle. Here is the way how the trapezius muscle action is checked. Ask the patient to elevate his shoulders, and the doctor or the examiner apply pressure or apply resistance against the action which is done by the patient. Then you can check the muscle integrity. Thereby you can come into a conclusion whether there is any nerve lesion or not. Here is how the sternocleidomastoid muscle integrity is checked. Imagine if you are checking the right sided sternocleidomastoid muscle, then you must apply pressure towards this face from the left side. Then ask the patient to push your hands. Then you can see the contraction of the sternocleidomastoid muscle here. If the spinal accessory nerve is injured before entering the sternocleidomastoid or inside the muscle, the nerve supply of the sternocleidomastoid and trapezius are in affected. If the accessory nerve is injured in posterior triangle, branch to sternocleidomastoid muscle escapes, but the trapezius muscle is affected. Then patient is unable to elevate his shoulders in the affected site. That is the nerve pathway of the spinal accessory nerve. And the lesion, what happens in the spinal accessory nerve lesion. Hope you could understand very well because this is very short. It has very short course and very little branches, 2 branches. And thank you for watching.